Hey guys! Welcome back to my channel. My name is Jewel. How are you today? So, actually, a few days ago, I hit my first milestone and I have 50 subscribers. And I know 50 is not a lot, but for me to reach that number, it took a really long while. I'm so grateful for my friends and family and all of you out there for supporting me and for subscribing to my channel. So if you're new here and you've never watched any of my videos before, do hit the subscribe button. I post videos every Sunday and stay tuned. Okay, so guys, today is the
26th of October 2019.
And for those of you out there who celebrate Deepavali, happy Deepavali to you. And for Rubel, if you're watching this video, happy birthday. Actually, I know that I haven't posted videos for 2 weeks, and partly because, I have this schedule where like the first week I'll post vlogs, and then the second week I will post videos on the Malay language, and then the third week I will post something on med school, and then the fourth week I'll cook. So the thing is, actually, for the past month I've been out vlogging, and I just feel like posting what I vlog. I don't actually like being tied down to a particular schedule. So that's why I haven't posted, because I didn't have a particular video for that week, and I've been actually quite busy ever since I entered my clinical year. So now with this video, I would like to propose a change. I no longer want to be tied down to a specific schedule. I will vlog as I please, and I will post what I want to post. I mean, hey, it's my channel, it's my name. I'm Jewel. I can post whatever I want. I noticed today, and by the way, it's the 26th and I'm filming this video today, and I'm gonna post it today. So I was actually scrolling through a few of the old pictures. I was looking at a picture from my friend Rubel, and then I noticed something. A month ago, I went to the bird park with Rubel, and I lost all the footages. I lost everything. I was supposed to make a vlog out of it for next month, and I lost everything, and I was like, I was looking forward to post that. Like, it's supposed to be my next week's video. Okay, so yeah, I don't want to follow a particular schedule anymore. So as you all know, or if you don't know, I'm currently in my third year of medical school, and in this third year is when I start my clinical year. So I'm currently in ONG posting. So for those of you who don't know what ONG is, ONG stands for Obstetrics and Gynaecology. So obstetrics is more on the field where you're dealing with childbirth, pregnancy, and the postpartum period, whereas gynecology, you're dealing with the diseases and the abnormalities of the female reproductive system. In my course, we will have to go to the hospital, and I am tied to Hospital Sungai Buloh for my third year. How is it different from preclinical year? Honestly, it's very different. Like in preclinical year, well, at least when I was in preclinical year, it was a lot of passive work. Like we would go to class from 9 to sometimes 12, or then there's a break in between, and then sometimes until 2 we will just sit in class, and then the lecturer will give the lectures. In clinical year, it's very different. Like most of the time we are on the move, and when there's actually a class, like, okay, for example, in one day our class will be from 8 to, well, on timetable it'll be 8 to 12, and then maybe 2 to, or well, on timetable it'll be 8 to 12, and then they will write their 2 to 4 assignment, and we don't know what's assignment. Even our lecturers don't know what's assignment, but it's on our timetable. So we will have like 2 bedside teachings, and then after our 2 bedside teachings, we will have 2 classes or 2 lectures. So these lectures are actually given by the student. The lecturers don't give the lecture. I mean, they will guide the student when they present. Like, the student will do their presentation first, and then after that they will correct where they go wrong or give further explanation on the needed topic. So bedside teaching, what is bedside teaching? I know they say bedside teaching, you go to the bed and to the side of the bed and you teach. So actually we're divided into a group of 10. Well, in my case we only have 9 in our group. So the day before, we have to clerk a case. So meaning we have to stay back in the hospital and we have to find patients in our current posting and we have to clerk them. And then for the next day, we have to give a presentation of our clerking case, and then the doctor will bring us to the patient that we are presenting, and then maybe correct us where we go wrong, and then watch when we do the examination. Sometimes the doctors will like bring us and then teach us how to clerk properly where we missed out. What about the lecturers? We have our own university lecturers. They are specialists, and we also have adjunct lecturers. So adjunct lecturers are actually doctors or specialists who are in the hospital. They are a specialist, like they work in the hospital, but then they are tied to the university. So in between they will come and like take us in for bedside teaching. They don't teach us in class, but they bring us up for bedside teaching. And so far for ONG, the adjunct lectures are kind of scary. You know, in the timetable, I said that the class is maybe like from 8 to 12, and supposedly we have a break at I think 10:30, no, 11 to 11:30, I think so. But we don't actually follow the timetable. So my day will go like this. If there are 2 bedside teaching, there usually will be 2 lectures. So in the morning, I will live with a few of my I actually live with some of my group mates, and they have a car, they drive. So we will leave here at 6:30, even though technically we live like 10 minutes away from the hospital, but we leave early. First, because we want to avoid jam. Second, because it's hard to get parking in the hospital, so you need to go there really early. So we will leave at 6:30, we'll reach there by maybe 6:40, 6:45. And then from there, we will like take our time, go to class, and see the patient that we clerked before, the day before, if they're still there, and then wait for the lecture to come. So the classes usually start at 8, and it usually starts with bedside teaching. So they will have the bedside teaching 2 sessions, usually 2 sessions in the morning. And depends on the lecture, sometimes they will accidentally take up more time, so you don't have break, and most of the time we don't have break. And then our lectures will usually start at 11:30, and it is given by the student. Now, if we have no lectures on that day, we have 3 bedside teachings. So on timetable they will show 4, but actually we only have 3. So for example, the lecture that we get, the doctor that we get for the first bedside teaching, it will be different for the next. And then we will also have our bedside teaching with the adjunct lecturers. So most of the time the adjunct lecturers don't come in because they're busy. They work in a hospital, right? So if they don't come in, they will substitute it with clinic. So what do they mean by clinic? We'll have to go to the clinic, and then we'll have to watch certain procedures. So now, what procedures should you watch? Like, they don't actually say in class like, oh, you need to know this. Basically, you're on your own in clinical year, and personally I like it, I prefer it. And how do you know what are the procedures you should watch? Like, even though technically you can watch it in YouTube, but like, how do you chase that particular procedures? So we have our own logbook. See with my picture in front. So we have our own logbook, and by the end of the posting, we have to complete at least 70% of it to get an A. So inside here, you can see they will show like you have to go to the gynecological clinic or the obstetric clinic or the labor room, and then for example need to watch, like they have like a checklist, like watch 2 normal deliveries, 2 episiotomy repair, and the obstetric wards watch the CTGs, and then BCG immunization, pelvic assessment, obstetric ultrasound, yada yada. And from there, if they substituted with clinic, we will actually go to the clinic, and we can choose. We can go to the obstetric clinic, or we can go to the gynecology clinic, and we will be tied to a particular doctor until a certain time, like basically how long we can stay, or until, you know, the patients are gone. So we'll be tied to the doctor. So basically whatever the doctor do, we will just watch. Even though it's not in our logbook, we just stay and watch. So if it's in our logbook, we get it stamped and signed by the doctor, so it goes to show that we watched that. I mean, technically you can still get it stamped and signed even though you didn't watch it, even though you watch it on YouTube or anywhere, but I mean, it comes down to you. You're the one learning. My time is usually done by like 12:30 or 1, usually 1, and we don't go back. Like, we stay back, have lunch, and then we stay back to Clark for the next day. And it's a bit hard to Clark at around 2 because most of the patients are sleepy that time, and their family just came by, and most of them have probably been Clarked by other students from other universities. So they will be very tired and worn out. We have to try anyway, we still have to try. Because you see, we also have to fill up a certain part. Like, we have to do certain number of presentation for the obstetrics, a certain number of presentation for the gynecology. So now if you're done with clerking, that's it, you can go back. But then there are days where we have to stay back for on-call, and then there are days where we have to stay back for labor room. Now, we have a very good posting leader, and she actually divides us equally to go for the labor room. So now, in the labor room, we have to find a patient. We will see the cervix dilation. So they will show maybe 4 cm, 7 cm, and we get to just choose whatever patient we want. If there are no students tied to them, so we just, and the thing is that they're in pain, but we still have to ask them, like, can we stay, can we watch, and so on like that. And then we get to watch a normal delivery, and if, touch wood, they have to go for emergency C-section, then they go for emergency C-section. And so far I have watched one normal delivery, and I have watched C-section. It wasn't an emergency section, it was an elective lower segment cesarean section. Okay, so what do you do in on-call? On-call, basically, you try to fill up whatever you can for the logbook. So in the first 2 weeks, like, I used to stay back most of the time just to get the most out of what I can fill up in the logbook. But because you see, the thing is, by the time you come back, after you have clerk the patient, you will, let's say, reach home around 4 or 5, and you will feel tired first. Second, you're hungry. So if you're like me, I will cook. So that takes up a lot of my time. Well, not much, I don't actually cook that long. I cook, and then I need to write up my case report to present tomorrow, so, or to present the next day. So even though technically I don't present the next day, because it's like this, each of us will have our chance to present, but we have to, like, grab it. And basically, if I presented to that lecture, the next time I don't have to present till maybe, unless maybe everyone have presented, something like that. So I will write up, and then most of the time, by the time I'm done, I will prepare my stuff for the next day. I will be so worn out and I'll be so tired. So what we notice, actually, most of us forget to study. And that is bad, because we need to study. We have exams for it. We have theory exams for it. Is it fun? Well, it depends on you. For me personally, I prefer clinical year than preclinical, because I'm not a person who can just sit down and listen. And I have this habit, and it's a very bad habit, for me at least, I think. If I were to sit down and listen to someone talk or teach, like in class, or if I'm watching a movie, I will fall asleep. I can't help myself. Even though I have had enough sleep, I will still fall asleep. And I notice that happening when the students are presenting, and the lecture catches me every time. Even when other students are presenting their case presentation, I'll be like dozing off, and the lecturer but the lecturers are kind, but still they'll be like, something is wrong with you, why are you always dozing off? And I'm like, I don't know. I don't know why. So yeah, I prefer clinical year. To me, even though the hours are long, it doesn't feel long. I feel like the days go by very fast. I can't believe I'm actually done with third week, and we have a week of holiday now because it's Deepavali. We have 1 week. I don't want to go back to preclinical year, honestly. Although they say preclinical is easy, but for me, like, cramming all of it, it's too much to study. Not to say now it's not too much to study, it's different because you're doing hands-on. So what are the kind of cases I've seen so far? Not much, actually. So for gynecology, I have clerked the patient who has GDM. GDM stands for gestational diabetes mellitus in pregnancy. So basically, pregnancy-induced diabetes, pregnancy-induced hypertension, menorrhagia, and simple ovarian cyst. So there's something I noticed, like I noticed that gestational diabetes is so common, and almost every time I will clerk a patient, I will find that they have gestational diabetes. That's sad because I never thought it would be that common, and turns out it's one of the common complications in pregnancy. It's pregnancy-induced diabetes, and yeah. I mean, if I walk outside, it's very rare to hear. Like even in my family, only one person that I've heard of has had GDM. What about obstetrics? I've clerked a patient with placenta previa, IUGR. IUGR stands for intrauterine growth restriction, and it's actually there are quite a number of people quite a number of patients I've clerked who have IUGR as well, and then one with oblique position of the fetus, and one and one vertex position, the normal position, longitudinal position. And the oblique one, I went for her elective cesarean section. So actually, she didn't want to do cesarean section, but she was advised to do because the fetus position was in oblique. Oblique means that you know how the head should rest on the opening of the pelvic, right? It should rest here. So it was actually resting here, this side. So if she were to push, the baby can't come out. Clerking is history taking and physical examination. So history taking, you have to ask, starting from their personal details, and then chief complaint, why did they come to the hospital? And then if they're pregnant, you need to get their history of present pregnancy, like okay, your first term, second term, third term, any complications, and then get more information about their chief complaint. You ask about their menstrual history, and then you also ask about their past obstetric history, if they've had a child before, any complications, their past gynecological history. And then you can ask their systemic review, come to a diagnosis, make a summary, and then you don't end there. You have to actually conduct like a physical examination on that particular patient. So now, how do you see? So you start off with the general examination, and then you go by systemic wise, you go to their hands, and then you go to their abdomen, and then if you can palpate them, and check for, and just conduct a physical examination. So now with what you have clerked, it's not a full clerk unless you have done physical examination, which most of us tend to leave out because sometimes the patient doesn't want to comply and we can't force them. I mean, they have their rights. So the next day we have to write a case report or a case write-up, and then we have to present it, and if we get the chance to present it, then well, good for us. And so now, how are we divided in the hospital? Like in my group we have 9. So far what we do is, since we are in ONG, it's the patients are, we don't blame them. I mean, we can't blame them. The patients are shy, they're females, and if a male student were to go, they can say no. I mean, they're students, they can say no, they're not doctors. So what we do is we partner one male to one female, and preferably one local to one international, because in Hospital Sungai Buloh, most of the patients, some of them can understand English, but most of them prefer to communicate in Malay, in Bahasa Melayu. So for international students out there, if you're gonna practice or study in Malaysia, please do learn some Malay, because it will be very useful for you. At least you can communicate with a patient. Like in my case, I'm partnered with my friend, and he's an international student. So what we have to do is, like, I will ask everything in Malay, translate it to him, then he will tell me where I missed out, then I will ask those questions. And the thing is, he's doing it like through a third person, and I feel I will benefit more because I'm the one talking to the patient. So it would be better if you can learn the local language, nothing to lose, even though maybe in the future you don't want to practice in a country where you have to use that local language. So yeah, So guys, I hope you like my video. Again, I don't want to stick to any schedule now. I'm gonna post whatever I like I will post video every Sunday. So do look out for my video. And once again, happy Deepavali 2019. Don't go and watch the video after a few years and be like, no, it's not Deepavali. Happy Deepavali, and Turbal, happy birthday again. And yeah, I'll see you next week. Bye.